It's a serious condition of the heart that can lead to blood clots, stroke, heart failure, and other heart-related complications. At least 2.7 million Americans are living with atrial fibrillation or AFib. While many people experience symptoms, others do not. That's why doctors say a routine checkup is so critical. KTIV's Michaela Feldman tells us more in HealthBeat 4.
About 20% of all strokes in the Western world, including the United States, are related to atrial fibrillation.
Atrial fibrillation is an irregular and often rapid heart rate that often can cause poor blood flow.
When the electrical signals are not transmitted appropriately and in an orderly way, the upper chambers go out of rhythm, being atrial fibrillation one of those rhythm disorders. And that creates what we would call an erratic, irregular heartbeat.
Dr. Artiega says it seems to be more frequent as patients get older. So what should you be on the lookout for?
Feeling their heart pounding or beating irregularly or erratically. Some patients feel short of breath, some patients feel fatigued or tired, some people feel lightheaded or dizzy.
Dr. Artiega says sometimes patients don't have any symptoms. So often it's detected in a full physical exam and electrocardiogram.
And the EKG will tell us where the heart is in an irregular heartbeat, in atrial fibrillation, in any other arrhythmia, or it is normal.
Once a patient is diagnosed with AFib, there are two goals of therapy:
the prevention of strokes with anticoagulation and get patients to feel better with some intervention.
If left untreated, AFib can lead to serious health problems like strokes, cardiac or lung complications. That's why Dr. Artiega says it's important to see your doctor and adds it's safe to do so now, even with the COVID-19 pandemic. For HealthBeat 4, I'm Michaela Feldman.
To help prevent and detect AFib, Dr. Artiega recommends seeing your family doctor at least 2 times a year for a full physical. People should also work to live a healthy lifestyle. That regimen includes routine exercise, weight loss or maintaining weight, healthy eating, and control of high blood pressure, diabetes, or any type of thyroid